Nick Bosa of the San Francisco 49ers suffered a knee injury in their most recent win over the Arizona Cardinals on Sunday. At the end of the game, head coach Kyle Shanahan told reporters that they were suspecting that Nick Bosa had avoided an ACL injury, but they needed some further testing to determine the extent of the injury itself. Also, there was a lot of initial speculation basically saying that because the fact that Nick Bosa could limp off of the field and he was doing high knees and other sorts of movements on the side of the field, that it was very highly unlikely that he had suffered a serious injury. It looks like, unfortunately, there has been a complete reversal in the initial suspicion of the injury because sources are coming out now saying that sources have in fact confirmed that Nick Bosa suffered an ACL tear and this is going to be season ending. Bosa is going to require surgery, specifically an ACL reconstruction, so that he can make a full recovery and return to the field. So with today's video, what we're going to do is we're going to look at the injury replay. Then we're going to talk about the relevant anatomy for this injury. And finally, discuss what it looks like for Bosa moving forward as he goes down the rehab process. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I try to explain them so that they are a little bit easier to understand. I'll also talk about the pertinent anatomy for that injury, as well as discuss the physical therapy process. If you enjoy this sort of content and you would like to see more of it, please hit that thumbs up and subscribe to this channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have suffered an ACL tear, go ahead and comment in the comment section below. Here we see that as Nick Bosa is rushing on the edge, he's going to plant here with that right foot. And when he does this, it looks like that right knee just gives out. Here I've got a model of the knee joint. And so the knee is formed by the femur bone that's going to come down and form the top portion here. And then coming up from the bottom, we have the tibia as well as the fibula bones. Now, there are 4 ligaments that contribute to overall stability in the knee. The first one and most applicable one for this video today is going to be the anterior cruciate ligament, or the ACL for short. As we flip the model medially, we have the MCL, or the medial collateral ligament. On the outside is the LCL, or the lateral collateral ligament. And finally, on the back, we have our posterior cruciate ligament, or the PCL for short. The ACL is going to have a couple of different functions at the knee. Because of its attachment points, the ACL is actually going to check or resist a motion like this right here. And this is anterior or front slipping of the tibia away from the femur. So it has that as a primary function, as well as providing a rotational stability going through the knee as somebody is performing a cutting or any sort of athletic explosive movement. It's a little difficult to see on this injury replay, but it looks like at the end here, as Bosa is going to stretch that foot out, that knee seems to cave inward, and that's where we see the knee give out. So the fact that we see him plant very hard and that knee just give out as that rotational force is going through the knee, this is most likely the moment that the ACL tear occurred. Here's another angle of the injury. So we see here that once again, as he's rushing, that right leg is going to swing out to the side, putting a lot of force going through the knee in a very compromising position. So initially, Kyle Shanahan said that the team did not think Bosa had suffered that ACL tear because they did some testing, but they needed to do some further testing. So what does that look like? Usually, if we get somebody that comes into the clinical setting and we have a suspected ACL tear, there is a test we can do, and this is called a Lockman's test. What we're going to do here is we are going to bend the person's knee. They're going to be laying down. And what we're going to do here is we are going to pull on that tibia toward us. And what we're feeling for here is we're feeling for any sort of laxity, and we're seeing if this reproduces a person's pain. What we're going to do is we're going to do that on the affected side, and then the non-affected side, if it feels more lax versus the non-injured side, this makes us think that there is in fact an ACL tear. If not, then we think that the ACL is intact. Although this is the standard test for any sort of clinical examination, it's important to say that sometimes when somebody is dealing with an acute ACL tear, there's a lot of muscle guarding, and it's going to prevent any sort of further movement at that knee joint. Not saying that happened in this case, but I have seen that in the clinical setting. The gold standard of imaging for diagnosing an ACL tear is going to be that MRI. In this case, we know that the MRI is torn, which is very consistent with a grade 3 ACL injury or a complete rupture. Grade 3 obviously is the worst case scenario when it comes to this injury, and what's going to happen afterwards is a full ACL reconstruction. Anytime somebody has a full ACL reconstruction, there are a few types of grafts they can use to essentially rebuild a brand new new ACL. The graft types typically are going to come from either the hamstring tendon, the quadricep tendon, the patellar tendon, or sometimes even a cadaver. So we expect him to have a surgical consult, and they will go ahead and decide on what type of graft to use. After this type of surgery, a person is going to be immobilized in a big long brace known as a drop lock brace. And this is because we want to protect the repair so that there's no damage to it. Then as the person starts to progress down the protocol, we can reintroduce range of motion. And finally, when we get the go ahead, we can introduce more advanced weight bearing and strengthening activities. The entire rehab process can take anywhere from about 9 to 12 months. It really depends on how the person is progressing and when they finally do get the clearance from the surgeon. So unfortunately for Nick Bosa and the 49ers, it looks like he does have a long recovery timeline for his return. If I happen to hear any updates regarding the specific type of graft used on the surgery and or the rehab process, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. So we wish Nick Bosa the best of luck moving forward with his recovery. Talk about a 180 compared to what we heard initially with this injury. Thank you so much for tuning into my video today. If you enjoyed this content, I'm going to go ahead and link one of my playlists so that you can watch some of the injuries that I've talked about in the past. Thank you so much again for tuning in, and I'll see you next time.